Hello, and welcome to our patient education video. Today, we're going to be talking about respiratory hygiene and the post-operative care. I am Nurse Kolby. This is my other nurse, Fayla.
In this scenario, our patient is a 75-year-old male who just got out of a knee replacement surgery, and we are teaching him the importance of respiratory hygiene.
Some questions that we're going to be answering throughout this video is pertaining to respiratory hygiene, specifically the use of the spirometer.
We will be discussing how often the patient should use the spirometer and what the spirometer can prevent.
We will also be addressing why the spirometer is so crucial for a patient like Walker.
You tell me which nurse I should listen to.
Walker, I have this for you. You need to do that.
What is this?
Doctor's orders.
What do I do?
Doctor's orders. Goodbye.
Okay.
Hey Walker, it's Nurse Fayla. Do you mind if I come in?
Yeah, of course.
All right. How are you feeling today?
Knees kind of sore and lungs a little sore too.
Oh yeah? Okay, well, I came by because I have brought you a spirometer.
What's that?
Well, this is a respiratory exercise that will prevent shallow breathing.
Oh, okay. So how do I use that?
Okay, I'll explain how. If you just sit up for me, are you able to do that?
Yep.
All right, so I'm gonna have you inhale
Okay.
using the tube.
Just inhale?
Yeah. All right, that was a good first try.
Okay.
Can I have you inhale slower?
Okay. Like that?
Okay. Yeah, you can go slow like that, but I want you to go slowly, but as much as you can.
Okay.
Maximum.
Like that?
Yeah, that was good.
Okay.
Walker,
Yeah?
how's that little device thingy going that I gave ya?
Oh, seems pretty good.
Yeah. How often have you been doing it?
I just did.
That was your first time?
Yeah.
Oh, amazing.
Thank you.
Love to see it. Love to see it.
How long do I even need this for? Am I good?
I don't know. Doctor's orders.
Oh, okay. Well, I'll just put it over here then.
Yeah, that's good. Let's go. Bye.
Hey Walker, it's Fayla. I'm back.
Hi.
How you doing with that spirometer?
Better.
Better? Yeah. How many times do you think you used it in the past 2 hours?
Only a couple times an hour. I'm pretty out of breath.
Couple times. You're out of breath?
Yeah.
Okay. Well, I know it's hard, but the reason that you're doing that is because we want to prevent the shortness of breath that you're experiencing.
Okay.
So
fight through the pain.
Essentially.
So why do I even need this thing?
Well, since you just got out of knee surgery, you are going to have a lot of mucus buildup in your lungs, and by practicing with the spirometer, you're going to move that mucus around, and it can prevent things like pneumonia from happening.
Okay, because I really feel like I can't get a deep breath. It's supposed to help.
Yeah, it's going to help, and the more you do it, the better that you're going to get, and the less shortness of breath you'll experience.
Okay. So why do I even need this thing?
Doctor's orders. The inventive spirometer helps Walker take deep breaths, expanding his lungs and preventing mucus buildup. Walker will now place the tube into his mouth and take a deep breath for as long as he can. Now, we will introduce the cough exercise to help clear any secretions from his lungs, reducing the risk of pneumonia and other respiratory issues.
When a patient such as ours undergoes surgery, especially knee replacement, they're at a risk of developing complications such as pneumonia or other respiratory issues. That's where techniques such as the inventive spirometer and performing cough and deep breathing exercises comes in. Yes, there are some risks to using the inventive spirometer. You want to make sure you keep this clean with extended use. By doing that, you want to clean the valve, mouthpiece, tubing completely. Otherwise, you would be possibly breathing in bacteria during your exercises.
An inventive spirometer will help improve lung ventilation. Ventilation refers to how much air is entering your lungs when you breathe in and how much air is leaving your lungs when you breathe out. It will also help this patient recover from anesthesia quickly, since he just returned from knee surgery, because it will clear that anesthesia from his lungs. It will also help loosen the mucus in his lungs. For example, the deep exhalations will prevent them from building up. And it will also prevent further lung complications. Those slow, deep breaths will fully inflate his lungs and help clear any fluids that may cause conditions such as pneumonia.
Now, we're going to review how often our patients should be performing these exercises, because consistency is key here. First, you're going to need your patient to either sit on the edge of the bed. In this case, our patient cannot, so we're going to sit them up in bed. Okay. Next, we're going to have the patient hold the spirometer in an upright position, like so. Then we're going to place the mouthpiece into the mouth and tightly seal the lips around. Then we're going to have the patient breathe slow and deep, as slowly and deeply as possible. You'll notice this little yellow piston ring here that will start rising toward the top of the column, and it should reach the blue outlined area, which is on the other side here, right within these measurements. We're going to have the patient hold their breath for as long as possible, or at least 5 seconds, and then we'll have them exhale slowly to allow the piston to fall to the bottom of the column. Then we're going to have them take a rest for a few seconds, catch their breath, and we're going to have them repeat this 10 times every hour that they are awake. Once you have finished using this spirometer, you'll take your yellow indicator tab on the side and place it to the milliliters of inspired volume that you got to, and continuing to move it up as you continue to grow. Then, after your 10 deep breaths, we're going to want to cough deeply so that we can clear the lungs. So we're going to have our patient cough for us here. All right. If the patient were to have a chest incision of any kind, want to make sure that you have a pillow or a rolled up towel against it so they don't cough and break the incision. Once you're all done and you're feeling great, you're not as dizzy, you want to try to get your patient to get up out of bed as much as often and walk around a little so we can continue clearing those lungs out. If you feel dizzy or lightheaded at any point while using the inventive spirometer, immediately stop using the device and alert your healthcare provider.
To wrap up, respiratory hygiene is crucial for post-op patients like ours to prevent respiratory complications such as pneumonia. By utilizing the inventive spirometer and practicing cough and deep breathing exercises regularly, the patient can promote lung expansion and secretion clearance, aiding in their recovery process. Remember, as future nurses, it's our responsibility to educate patients on the importance of respiratory hygiene and support them in practicing these techniques. Thank you.
Thanks for watching.